this morning. The Prime Minister said that he is hopeful that all children in England can start returning to school from March the 8th, just over 3 weeks away.
Now, it would be the first step in a cautious easing of the lockdown, according to Boris Johnson. Let's get more on this from Dr. Deepti Gurdasani, epidemiologist from London Queen Mary University. Good morning. Do you think that this is about the right timing to send children back to school?
I think we took children out of school, at least most children out of school, because they were contributing a lot to community transmission. So the idea that we can bring them back to school without actually changing anything else and not see the same surge in cases we saw before is unrealistic. I think what's really concerning is that we're bringing back children to school, but in the same conditions. Even when outbreaks are happening in schools right now with limited attendance, we really need to do something different if we're expecting the outcome to be different this time round.
What is the evidence? You say that they're responsible for this surge in transmission. What's the evidence for that? Because there has been, over the last 10 months, a lot of discussion about how much schools were driving infection cases.
Yes, so this is evidence from SAGE, actually, that suggests that they have been contributing substantially to community transmission. So if you look at the ONS household survey, between April and November, primary school children were 2 times more likely to be the first case in the household. Secondary school children 7 times more likely than adults to be the first case in the household. And both, when they became the first case in the household, were 2 times more likely to transmit to adults or other members of the household than adults, so that's a 17-plus age group. So children are clearly very exposed. They come into contact with many, many more children in the school environment and much more likely to transmit when they're infected. At least that's been the results in England from testing, random surveys of people and looking at household contacts.
But if all you were dealing with was coronavirus, then that's one thing. But we're not, are we? We're dealing with the health and well-being of children who need to be back in education and the lifelong consequences of keeping them out of that for too long, whilst also, of course, acknowledging schools are still going on, teachers are still providing education, but nothing like the level that I think most people in education and parents would say they benefit from by being in school. So if it was just about coronavirus, that's one thing, but it's the balance. And if the most vulnerable have been vaccinated, can you not see the case that there are risks, of course, with them going back to school, but they're outweighed by the benefits?
So I'm not suggesting that they don't go back to school. What I'm suggesting is that they go back to school with safety measures in place so that we don't see exactly the same surge of cases, which would lead to school closures again. So actually the impact on children's well-being with a sort of yo-yo, taking them out of school and putting them back, would be much worse than putting in safety measures and planning for school openings in the proper way, which is what independent SAGE and many experts have been suggesting. And while we vaccinated, the above 70, much of the above 70 population, we need to remember that vaccination don't have a huge impact on transmission. And if transmission surges again, the majority of people in critical care, for example, are below 70 years of age. So we could still see ICUs getting very full and still see many, many deaths, because many deaths actually occur in people under 70 years of age. In fact, SAGE modeling showed that with easing of lockdown from March onwards, if transmission was allowed to get high, even in the most optimistic vaccination scenario, we could see between 85,000 to 150,000 deaths. And, while there are caveats around the modeling and the assumptions around vaccine effectiveness, we can see tens of thousands of deaths if we allow cases to rise, as well as many more cases of long COVID.
Well, yeah, I mean, there are lots of uncertainties around this. We ought to say that we don't really know the impact of the vaccination programme on transmission. As you say, we have to wait and see. So what would you do to make schools safer? How would you do it?
So I think, we just need to follow CDC and WHO recommended measures, which is we need mask wearing in schools. So that's secondary schools, but also encouraged in primary schools. We need much better ventilation.
Sorry, can I just ask, do you think primary school age children should be wearing masks?
Yes, and this is nothing new. This is being done in many parts of Europe, including in Spain, and is actually recommended by the CDC as well in high transmission areas. We've not seen any harms to children come from this, and millions of children across the world wear masks in primary schools. We also need air filtration and purifying devices with carbon dioxide monitors. This is an investment worth making, which many countries in Europe, so including Germany and the US, have been doing, and significantly reduce the risk of transmission. We need to try and reduce our class sizes. We have one of the largest class sizes in Europe. reduce the size of class bubbles. The Department for Education currently does not have a cap on bubble sizes, and many schools have bubble sizes up to 300, which is not a bubble. So we need to put all these measures in place to really ensure that children are safe, so that when we do open schools, we don't see a repeat of what we've seen before, because there's no reason, as you say, vaccinating 20% of the population is not going to impact transmission. So if we're expecting results to be different when we put children back in schools this time, we need to do something different.
Okay. Many thanks indeed, Deepti Gurdasani. Much for, well, the governments of all four nations to consider there in terms of getting children, or more children, back into schools.
6:30.